a class, a live workshop, a new method we're going to have in our school, which is to transmit directly in our virtual classroom. They can be like now many of you live. But those who are registered, as soon as the lesson ends, you will receive the recording of today's class. It's an interesting class, mainly for dentists, because we'll see. Let's talk about an important topic, which is the central relationship, but we are not going to talk about the central relationship itself. We are going to talk about the central relationship, comfortable and relaxed. I am going to teach you in this workshop a technique like finding the central relationship, but yes, something that I consider important to know. If when we do a rehabilitation, we are in a central relationship, and so we are going to review what posturometry is so that we can understand at the end the reason behind the central relationship at the end of our talk today. So let's start talking about centric relation. How to measure the centric relation? Occlusion, you will see occlusion and centric relation, and I can't omit any important element. This gentleman who you see on the screen, Galileo, if many years ago I could have shown the Earth, no Yilaba, the sun didn't revolve around the Earth. Oh, he wouldn't have had to say that famous and corny phrase, it moves. That's why I say all scientific things are measured. Yes, let's see, this man was my teacher in the year 19. In Seattle was the inventor of magnetronic technology. Bernard Jenkinson told me a phrase that has stuck with me for a long time. And I was saying that the clinical opinion could be false or true, but that's an opinion. Yes, Armido is science. That's why he invented the myotronic, electronography, and other things to measure of the muscles. And so today we are going to talk about posturometry and stabilometry. Osteometry and stabilometry, great ways to measure our state of equilibrium. We at school, but those who are from the school know it. Those who are not, we promote the balance between the craniofacial system and the rest of the body. And what better way to measure if what we did in the craniofacial system is in balance with the body or not? In the then posturometry. What is posturometry? We all know that posturometry is a science. It is a medical science. It's not empirical. It's a medical science, just like posturology, like the anatomy, the physiology. And it is the science that studies and measures the static posture of the body. Miguel, without static postural balance of the receptors among themselves. In our protocol, we measure the static balance among the receptors. And why? To see if they are in balance or not. Look how important it is to know if you are in balance or not, and analyze if they are not in balance, what pathology might have caused it. How important it is to measure, and we will see this in the centric relation. So first of all, the posture needs to be analyzed, study it to correct later. And that is what we do with clinical diagnosis and instrumental diagnosis. Here today, we are simply dedicated to for one part, which is the diverse stomatognatic system, and that jaw and that occlusion are in balance with the rest of our body. Those who follow me know it. There's no point in asking them the common question. But for those who don't follow me, they're hearing it now. Out from school, live or recorded, what do they have in common from the best possible various center? The whole body, every human being, seeks for its center of mass, the body center, to be as aligned as possible with the Earth's center of mass. Why? Because it uses less energy there. And that's a fundamental pattern. Keeping the center of gravity as close as possible. Now, the ideal balance point of the Earth, because the body uses fewer afferent and efferent signals there. They are standing. If the bases were fine, if the center of gravity were fine, it wouldn't fall. The balance of our body, it's a constant balance in all situations. You all observe the ballerinas, right? Their body is straight even when they move, always seeking the center of gravity, adapting so that the Ali center is well balanced. And the question, how much does it shift the center of gravity, a key player. But it's interesting that people make shots, very important shots, that of the people that the hit, what they call the hit, to hit, notice if the body is straight. If you go here, it's straight, 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 straight. But it adapts. Adapt, all of them have lower back problems due to this adaptation to give a perfect shot. And the same happens with a shooter. If you see the shooter, he spreads his legs to aim, maintains balance for better accuracy, and then maximum energy savings. Looking for the best parry center. Always remember this. Why? Because it is the example of scoliosis. When the receivers don't work well, it adapts, it keeps adapting. As scoliosis develops with that adaptation, it's important to keep this in mind. Maximum agro energy, fewer resources are used there. And as a consequence, the muscles are used less. The brain is lazy. It doesn't want to spend energy. So maximum safeguard against danger, maximum defense against pain. Take antalgic positions. Always remember this. If there's pain on the right, it shifts to the left. Cedar to the left, escapes to the right. And that's measured very well with Michter's posture. One can make a very precise diagnosis of the patient's condition. Maximum defensive position against pain. Human beings do not want to suffer. All this is done by the central nervous system automatically to find that ideal varicenter in relation to what are afferents and referents. Afferents and referents are what comes in and what goes out, what comes in and what goes out. Never forget that. What goes in is what goes out in the body. It is very important to understand this. And then here comes the chorus. Afference and afference is like a chorus. In the choir, one voice now working is enough to make the melody out of tune. In the system, in our tonic postural system, that is to say, the system responsible for maintaining the neuromuscular balance of the body, to a receptor that does not work, disrupts the melody. And that's why it's important when we say measure, we measure that. We identify what isn't working and go directly to fix it. The center of gravity is only obtained when there is a perfect balance between what comes in and what goes out. When are we going to achieve the perfect balance if a receiver malfunctions? Never. That's why the proper functioning of receptors is important. This is Hippocrates. Hippocrates told us that each part is a circle, the body. Each part is what? Okay. A whole. Each part is a whole. Everything. So, and at that moment we understand that we can't imagine being alone in a place. Please, I think Maria Emilia has her microphone on. Can you please mute it? Maria Laura, sorry. This way there's no noise and I don't disturb. So when we say that the human being is working in balances. We have to understand that we require these 7 receptors. The receptors, please remember that it's important, and all this is about balance. Perfect. Everything is the beginning, everything is the end. Why did he say that? That sometimes the symptoms of an illness are in one place, but the cause is somewhere else. They are reflections on the science of patterns, and it is important to understand and measure them. All this we are talking about, all these reactions happen in milliseconds. Look, everything from the sound waves, sight, vision, everything happens in tenths of a second. And then the receptors regulate that function. Fast functions, very fast, from the outside to the central nervous system, so that it knows where it is living, knows where it is developing. And then there we see the eyes, vision, eye movement, convergence of peripheral vision and central vision too. Determines the position of the head if that does not work. Not working, the neck is in bad shape. There we have the vision and oculomotor coordination. All of this makes that maintaining good posture is important for ergonomics. It's very bad these days, the receptors in the skin, the epidermis and the dermis. Here we have Pacinian corpuscles and Ruffin endings, which inform the central nervous system. Scars, something we sometimes forget. Scars are on the skin, and they are interfering with those receptor corpuscles. If we don't treat the scars properly, the muscular chain will work. That sensitivity is very subtle, very subtle. I put this picture of the little mouse touching elephant skin, and just like that, it quickly reaches the central oligarchic system. The foot is the most adaptable element, joints, muscles, and so on. The foot is only causative in rare cases, very rare cases. So we need to see the occlusion, the scars, etc., the ear, hearing, balance, and everything involved. The viscera, the proper functioning of the viscera. How important diagnose, no? Right? But how important it would be to measure how that works. Today we won't talk. I'm going to do a series of webinars on how to diagnose the possibility, how to diagnose when I can omit the intolerances, how to diagnose vision, convergence, conduct different webinars in our classroom, because this is educational for everyone. So imagine being able to measure all of this and know where we are. From the model that moves the entire craniosacral respiration. The stomatognatic system, a series of receptions, the periodontium, the tongue, the TMJ, the muscles, teeth, and this is important for us to remember. We who are dentists know this. But we need to remember what we are not, and we must understand it. Okay, so teeth come into contact 3,000 times a day. Why? Reception, proprioception. During those days, those 3,000 times, what happens when we swallow? When we swallow 3,000 times, they come into contact. If not, the teeth are not in contact. What happens when we swallow? First, the muscles contract. Big teeth. We reposition the condyles. The tongue contracts and pushes upwards and forwards. The hyoid bone is lifted. Often the head moves, bringing the chin forward, moving the first and second cervical vertebrae. Neuromuscular and neurotendinous are activated. Periodontal receptors are stimulated. The Schwinn capsules and ligaments and menisci are stimulated. The lingual receptors are stimulated. It focuses on suprahyoid and infrahyoid muscles. It moves. The second part of the motherhood sanctuary. Look at everything that happens 3,000 times a day. Imagine if those 3,000 times a day we are out of balance. It is terrible, right? And so let's see now, before we see how they are measured, the central relationship and the structure. A quick review of the Mr. Postulate's structure. It's important to keep it in mind and measure the postulate. Afterwards, it's an objective tool that allows all of us to have a record of what happens. He doesn't do what we want, but he measures. This instrument, let's remember that it's based on the concepts of Kapanji. Kapanji, reviewing his history, it's because he's still alive. I think he's 86 or 87 years old. I thought it was Francesco who lived his whole life in France, but he's Turkish. He studied how it is distributed to a joint from a vertical perspective, to the external value, like how the body's weight is distributed on each foot. This is almost mathematical how it's distributed. It's distributed 3/6 in the calcaneus, 1/6 in the fifth metatarsal of the pinky toe, 2/6 in the first metatarsal of the big toe. Every 6 TOF, TO. The posterior meter has 3 sensors in the measuring room. That's why it measures the load on that. Obviously, it's not hardware. The important thing is the protocol I've created for this nomination, the diagnostic protocol of treatment planning with software dedicated to it. Study posturometry. Those who are studying posturometry with me realize that it's not easy. You have to study posturometry. Why? Which is something clinical, something for comparison. Doesn't learn it. Because in 30 seconds, it learns to diagnose everything. 3 measurements, 30 seconds. So for this test to be scientific, it has to be repeatable. And then the posturometer is set up. Do you see it there? Look on the postulator. The Cascano rests on the horizontal line. It has 3 lines for the small foot, the medium one, and the large one. And then you pass the vertical line between the first and second finger here. And that's it. You just need to know what line it is. And then it repeats in the same place every time. The purpose of this test is to highlight the main receptors, eye, foot, and the great disruptor, that is the stomatognatic system. It is important to understand that the stomatognatic system constantly disrupts and disturbs. And Three tests are the basic protocol: mouth open and eyes open. First test 10 seconds, second test mouth closed, eyes open. Third, mouth open, eyes closed, 30 seconds. What are we measuring here? In the first test, we measure posture because the eyes are open without the interference of the mouth. The second test is the effect of occlusion on body posture. And the third is lung support. With three simple tests, we have a complete view of the organism. It has a particular chart where you can read it. This is the posturometer chart. You read it like this. It's very graphic. It can be seen quickly. It's normal when it's green, increased when it's red, and lessened when it's the tip towards the back, the tip of the triangle, and yellow means caution with a traffic light. Alteration, caution, normal. It is very graphic when one understands posturometry. One has fun measuring. You can measure everything. You will see, I will do different webinars on how to measure biochemistry, how to measure intolerances, how to measure the psyche. I am going to position. It's important to understand. It's a very, 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 very useful element. And then imagine we are going to talk about the mouth now. To the left of the screen, we have the chart with an open mouth. And to the right, mouth closed. Notice how here the mouth is trying to correct this postural alteration. We say that when trying to correct, the mouth is a victim of a postulated alteration. He is trying to correct a posture problem, but most of the time it is the cause of the posture problem. 1 kilogram, I close my mouth, 2 kilograms. Here the mouth worsens the posture. Mouth is the cause of the pain. Of the problem statement, in a stabilometry, we measure 3 graphs, which are through the normal center. We will see the change in speed, the shape ratio, and the coverage area of the center of mass. What does this give us? The speed variation, the comfort, you will see it later. I will show you the software, how it works. The change in speed, comfort. The form relationship is the relationship between anteroposterior and lateral oscillations. And we can diagnose many things with that. And the coverage of various centers in millimeters gives us muscle tone. These three values give us a very big idea about the state of the tonic postural system and the shape of the support center and how it should be. Many years ago, in 1990, I did a nice investigation to see what would happen if we put pre-contacts on each of the teeth, to each of the teeth, and saw what happened, wanted to see what happened, what was happening with those contacts, right? And then we placed pre-contacts on the incisors, on the canines, and studied and measured. And was surprised. It was nearly always repeated mathematically. Contacts on the incisors and canines mathematically reduce the load. On the first ipsilateral metatarsal, that is the pre-contact phase, psychiatric incisor. It was on the left side. It automatically decreases first by treating the left side. The contacts in the premolar and molar area, we are decreasing the load on the fifth metatarsal. And the contacts in the second and third polar zones, that is, the pi curve decreased in the calcaneus. This was repeated mathematically. For example, it was like this. And anterior was related to the first metatarsal pre-contacts. The plane of occlusion related to the fifth metatarsal. and the spill curve, what we call the posterior guide, with the chattering, seen from another angle. First metatarsal, fifth and calcaneus as it went. What should make us think that the mouth can affect the foot and vice versa? From bottom to top, it can affect the mouth. That's why it's important to have a holistic interdisciplinary vision and measure. One can identify this very easily. Look, here it loses charge, meaning there are pre-contacts on the previous one. Who has lost load with respect to this pre-contact in the occlusal plane? And here, I lost the load at the calcaneus, the pre-contact at the guide of P. Look, we can study the occlusion by measuring the post-contact. Hypercontacts and torque. Look at you all how not only increased the load, but also the torsion as the torsion of the body worsens. Here it loses load. Here it means that this pre-contact, which was green, is now yellow. This pre-contact is causing torsion. We can also measure the torsion, and the jaw follows that torsion mechanism. Look at how the jaw has pre-contacts. Tilt the jaw, but tilt the body. Important that I will know by facing it, right? And then the centric posturometric relationship. I mean, what does it mean? To have the centric relation, that is the posturometer that tells us we are in centric relation. How is it measured? Mouth open and mouth closed. Imagine if we had finished the orthodontic treatment. We have finished a prosthesis and we want to know if that the work we did does not interfere downwards with the tonic postural system measured with mouth open and mouth closed. We compare. I'm going to show this to a finished patient, an orthodontic patient, who has completed their treatment with the centered relationship, cynocentric. How does it look in the posture analyzer? I'll show you the charts here, and then I'll show you the posture analyzer, so you can see it on the posture analyzer chart. Look, everyone, we are here with our mouths open. The patient weighs 2.2 kilograms, right? Cover with your mouth closed better, but that's not all. The jaw doesn't change direction. It means that you no longer need to be focused on the same spot. Otherwise, the jaw will go one way and the posture would shift in that direction. Centered, that is centered relation. Unimagined measure. And look how the distribution improves. All green. What does it mean? That there are no pre-contacts interfering with the mandibular posture. It improved the distribution. Important, I'll say, and see it there. Barycenters. Pay attention. In both coincident central parietal situations, no? And then his mouth, it's not affecting. We can go calmly and sleep peacefully. That voice doesn't affect the tonic system. How important all this is. To be able to measure it, to be able to study it, to be able to have it there. And look at this. It doesn't affect the foot. It's important that a craniofacial system does not affect the body. Sometimes I work without the mouth, and we don't realize that we are altering muscle chains. We are overwhelming the stance, and unfortunately, the symptoms do not appear the day after we did the treatment, but it comes much later. Imagine seeing this earlier yourselves. And knowing this measurement is also important. Another thing, the muscle tone. When the tone in a closed mouth drops, the value drops. When the value drops, there is tone. A mouth that is not well loses tone, meaning that value would have increased. Another indicator that we are centrally related to the jaw. Imagine dentists doing a rehabilitation, an orthodontic treatment, knowing that it's not interfering with the rest of the body, because if it interferes, the body will make it pay one way or another. Sooner or later, it will separate. And look, another value to consider. The torsion, notice it, torsion improves. It doesn't worsen the twist. What does this mean? Does it mean what? With a few values, we can go checking if we're doing well or badly. I'm going to show you. I'm going to stop sharing this for a minute, and I'm going to share. You saw the dessert. It's for you to see. Let me open the software. I'm going to open it and move to another screen. I'm going to show you just a minute, and here it is. Well, this is the software from what I was watching before the light dimmed a bit. And there we have it. It is very big here. There we have it. If we go and see. These are the two exams when the patient is quite elderly from 2013. This patient, and we are going to look at the tests. The sun is in a cloud, and it allows us to see it anywhere in the world. And look what we used to see. Before it was slightly open, now it is closed. And just like here, it gets better. The various centers, the foot, and the trio. And that's what's next. Here are a lot of patients, 18,000 measurements of patients. This is the software that allows us to measure many things. We can measure today, we are talking about centric relation, but we can measure if a foot works well and insole. Many things with instruments, with a measurement that in 30 seconds. Each exam takes 10 seconds, so you can see how you can realize how. Stop sharing how you can use an instrument to find out, to be certain that we are in balance. And why is it important to know that? If you study posture, you realize that interference between systems, the interference between receivers, the interference between what we do to the rest of the body, they don't work well, unfortunately. Takes, you see, after a long time. Imagine being able to identify it first before the catastrophe happens by measuring with the posturometer. Well, this is today's lesson. Hope you liked it. If you have any questions, raise your hand. And if you like, I'll unmute you and answer it. Otherwise, we'll conclude here and you'll receive the recording to listen to it later. Review this class, watch it at home. I hope it was useful in today's class. Hope you enjoyed it in the class. And if there are no questions, see you in the next R.M.P class, virtual meeting room. See you next time, friends. Humberto, tell me. I'll unmute you and you can ask your question. Let's see, Humberto. There's the microphone. Good afternoon. Can we hear you? Yes, I hear you well, Humberto. Tell me everything. Yes, okay. In your corso If someone managed to determine the central relationship with the platform, say another person in another part of the world would have to identify the same central relationship, the same balance. Wait, I don't understand the question. Are you talking about a patient who is, for example, in Mexico, where you are? Yes, and that one travels to Europe. If you go with someone or with a colleague, you have to measure. If you have the posturometer, you can measure, of course, but not just that you can measure. Well, what we have in that cloud, we are creating access for people who work together around the world. So, for example, you measure in Mexico, and if the patient comes to Europe and I see them, for example, I measure them, I can access the measurement you made, I can compare. And if not, it doesn't make sense. If I can't see how it was, I can't compare, you know, Humberto? For example, I can go in and see what you are doing. And you can also go in and see what I am doing. And not only that, how this application allows you to see it, not only on the PC and with any operating system, but also on the tablet or smartphone. Imagine we are studying together in the master's program, and you send me a patient for me to see. Travel, for example, here to Europe, and I have to see it. Well, I can communicate with you. Sharing. Now here, if you can share what I'm doing with the application, do you see it? And we analyze it together. I can ask you things and stuff in real time because you'll see it in real time since we share access as a working group in England. And not only that, for example, I can guide remotely. Obviously, my experience is almost 40 years. Well, we can connect. I can see what you are doing and guide you, just like we guided in the orthopedics master. I can guide you all remotely because this information isn't on your computer. If it were on your computer, I couldn't. That is a training that is in the cloud, and then anywhere in the world where I am or where you are, you access with your credentials. Did you understand, Humberto? Okay. Yes. Did he clarify for you? That was the question you were asking me, you were telling me. Yes, that's partly one. Let's say the centric relation point, whether it's the form relation, the speed variable. If I measure it in Mexico, would it have to be the same or very close if you measure it in Europe? It has to be like this. Nothing should have changed. Now, obviously, there's a great intolerance, right? Obviously, in the values. But the values I gave you have to match. The muscle tone has to decrease. It has to win a whole ocular. The patient must be at a good comfort level. There should be no torsion. There should be no pre-contacts in the Kapandi series. There has to be overload. Obviously, that day, for example, imagine you send me a patient to Europe from Mexico and I measured her that day. I'll measure her posture when she comes to me. The posture as it was when you measured her doesn't help me. But with that posture he has today, the mouth shouldn't change anything. You understand? Imagine that patient. That patient we saw today weighed 2 kilos. Imagine if he comes to me at 1 kilo, or with 2.5, or with 3 with mouth. Open mouth. With closed mouth, it doesn't have to worsen. You understand, Humberto? They must always maintain a central relationship. It does not alter the body's posture. And to see if it affects them or not, you need to see those values I showed you. You need to see open mouth and closed mouth load distribution. The overload on both sides, the muscle tone, the torsion, and obviously the comfort of that patient. With those values, it is safe. It's not that it has to be, if it had 2, it needs to have 2, but it needs to be in that comparable range. You understand? Of Humberto. Because imagine a patient who suffered a foot fracture. He won't have the posture he had when you measured him. There was a fracture of the foot. But the mouth doesn't have to alter that posture. Do you understand, Humberto? Imagine that patient comes today, and his posture is 5 kilograms. So the mouth has to maintain 5 kilograms if it is centered. When the mouth does not maintain that relationship, it is not centered. It is interfering with the muscle chains. Very easy to measure that. Did I answer the question? Yes, already. Okay. Thank you. Do you have any other questions, Humberto? No, that was it. Just it. Well, very good. I'll take it off. I'll take the microphone away. If anyone has a question, let me know. I don't know if Andrea raised her hand or wants to ask something. Andrea, I see you there with your hand raised. I don't know if you're asking a question or what. If there are no questions, well, I'm going to leave you later. The registration will arrive and they can review this class as they want. Thanks for being here, those who are here, and thanks to what they hear afterwards. I'm going to give some information for those who are in the classroom for the first time. If one registers, I will do the live workshop within this virtual classroom, because we have the academy classroom for that, right? So if someone registers, even if they are not present, afterward you will receive the registration. That's why I insist so much that you register. Why? Because this class was ending. The recording ends, the class ends, the video is edited, and once it is finished, you will receive the link so that they can watch it again as many times as they want at home, even if they were not there. But if they are not registered, they will not be able to see it. That is why I insist so much that if they want to follow it, they register. Because if they are not registered, I have no way to send it to them, because we are always going to broadcast from our academy, from inside the academy. So those who want to study with us here will have to be present. And it's free. This is free. Well, dear friends of the R.M.P, rest well. Have a great weekend. So the students who study with me, we will see each other in the next classes. And those who are here for the first time, well, we will see each other. We want, in the next webinars, we're going to do several webinars. There is a very nice one now. If you are registered in our application, we are going to have a very nice psychology webinar. And then we will also see the parameters. It's going to be another one in English as well with Dr. Sayed. Those who are interested, register there and listen to it later at your own pace. Enjoy the weekend, dear friends. Thanks for being here with us. Thanks for participating. And thanks to those who will watch the class later. Goodbye, everyone, and have a great weekend.